When your body temperature goes above 40 degrees Celsius to 41.5 degrees centigrade or 104 to 106.7 degree Fahrenheit, doctors label this as very high fever. If the fever is associated with other symptoms like sore throat, ear pain, cough, or wound infections, we must treat this as bacterial infection. Mild or moderate fever is often associated with serious infections like glomerulonephritis, pneumonia, meningitis, pleurisy, endocarditis, or names that ends with itis and sepsis. Please know fever as a single symptom cannot help doctors to diagnose any illness. Blood tests are used to confirm the diagnosis, and they are often not 100% correct. So please share the story of the illness, associated symptoms, and not waste time talking about the temperature. Is fever merely an annoying symptom, or could it perhaps play a vital role in our health? Let us dive deep into the intriguing world of fever, a complex yet crucial response of our bodies. Our body temperature can increase when we are exposed to hot weather, when we perform exercise, and when we are sexually aroused. So fever is a physiological response to increased body metabolic rate. Imagine this: someone slaps your cheek, or starts shouting at you. Immediately the area turns red and hot, and heart starts beating faster and faster. This is physical insult, and so you notice swelling, pain, hot, and discomfort on the cheek. This reaction is what we call inflammation. Our body perceives an impending threat, and our sympathetic system kicks into high gear. It releases neurotransmitters, which send a message to our brain's temperature regulation center, the hypothalamus, instructing it to turn up the heat. As our body temperature increases, the conditions become unfavorable for the invading bacteria. The heat accelerates the functions of our immune cells, making them more effective at fighting off the infection. Simultaneously, your heart starts beating faster, pulse rate increase to boost blood supply to the area. An army of white cells arrive to kill the germs. Historically, fever has been recognized as a valuable symptom that warns us of problem in our body. Doctors use temperature charts to differentiate infections like malaria, typhoid, and tuberculosis before tests were developed in 1970s. Before antibiotics was discovered, doctors induced fevers to kill germs that cause sexually transmitted disease like syphilis. Fever is not merely as a symptom, but as a strategic body response to any insult. Bacteria release enzymes to shut down temperature regulatory center in the brain, dilate blood vessels, and open sweat pores. The body temperature plummets rapidly, causing the person to alternate between feeling hot and cold. As sepsis advances, a sensation of coldness may arise, signaling a critical illness that could lead to organ failure and death. So, what's the key takeaway here? Doctors label this as very high fever. It's a complex response to infection reflecting a delicate balance between our immune system and invading germs. It's a sign that our bodies are actively fighting to protect us. So absence of fever is also important information that doctors must know. It's not something to dread or suppress, but be grateful we have this amazing protective reflex. Understand its purpose and always monitor the type of fever you have. Always speak to a doctor if the type of fever changes from high to low or when you start feeling cold. Remember, fever is a potent ally in our body's defense against infections. You must familiarize yourself with the types of fever and not worry if the temperature is raising. So, the next time you're feeling under the weather and your temperature spikes, don't panic. Seek medical advice, but do not rush to hospital or doctor's clinic. Viral infections suppress immune response. Hospitals and doctor's office are said to be colonized with 12 superbugs that we cannot kill, and you are at risk of getting infected. Remember, every illness or disease is a form of inflammation, including cancer. As always, speak to a doctor when in doubt, and do not rush to ask a friend, chemist, or nurse in urgent care center. And that concludes our exploration of fever for today. Keep your curiosity alive, stay informed, and maintain your health. Please follow, share, and leave a comment to help us help you. Thank you.